everyone, myself Dr. Pandurang Vattamwar. I welcome you all to the Indian Academy of Neurology talk show, Legends in Neurology, with very special guest, highly distinguished and eminent neurologist, Dr. Professor K. Radhakrishnan sir. He's my teacher. So it's an honor, privilege, and my great pleasure to be with you, sir, today on this show. Although he needs no introduction, but to say a few words, he is a very well-known neurologist for his illustrious work and exceptional research in neurology, especially in the field of epilepsy, getting him acknowledgement from all the quarters and global reputation. He was instrumental in establishing R. Madhavan Nair Center for Comprehensive Epilepsy Care at Sri Chitra, Trivandrum, making it first kind of a center where the management as well as medical as well as surgical management was provided for patients with epilepsy, and it was started in the year 1995. Since then, his substantial contribution has helped establishing many epilepsy surgery centers, not only across India, but also neighboring countries like Sri Lanka and Bangladesh. He is an extraordinary, devoted, and insightful teacher, a prolific orator, a great administrator, and at the same time, he is compassionate and humble human being. So today it's an honor to have Professor Radhakrishnan sir amongst us to know about his life journey. So to begin with, sir, tell us about your childhood and your family, and how you were as a student, whether you were so much disciplined and hardworking since your childhood days, or was it the influence of your parents, or you had some idol to look upon?
Thank you, Pandu, first of all, for that the introduction, which was quite elaborate. And also let me thank the Indian Academy for giving me an opportunity to take part in this talk show. I was born and brought up in a village in Palakkad. Now, if you could show me that the first slide, we can go through that early part of the whatever you wanted me to address.
Yeah.
So we can go to the next one. And I was the second of the 5 children my parents had, and then my father was actually a doctor. He was, in fact, a tuberculosis specialist. That time there was a degree called a TDD, tuberculosis disease diploma. So in addition to his MBBS, he had that also. He was in the Second World War, was actually in Burma, and subsequently he returned back to India and got settled in that village. Prior to that, he also took up, he was a tuberculosis officer in Karnataka, actually in Markara. Now it's called Madikeri, but it's called the Coorg also. He had tremendous influence on the way in which I took up medicine as my career. In fact, I started my education from the 4th class. At the time, there was an option that you can study from home, and you need to join only the class which you wanted to start. So my early schooling was at home. And one of the incidents which made me to take up medicine, I just want to briefly narrate. I think I would have been something like 8 or 9 years old at that time. He was a very sincere, very devoted practitioner in that village. A boy was brought with a clear water drowning, and he was almost dead. And I saw him reviving that boy through the resuscitation. And I was helping him with the hot water massage and all those kind of things at that time. And then when the boy finally survived, and then few days later, we were playing together. We were of the same age. Then I decided that this is a profession which I wanted to pursue. And then that was the beginning. The next one you can project. My mother was a housewife, and then the next one, if you go to,
yeah,
I got married in 1977. Jaya, you have met when we were in Sri Chitra, she actually is he was a blood transfusion officer at the neighboring RCC during that time. And post-retirement nowadays, he is not working, he is looking after the children. Next one, please. And we have the two children, that is Nisha and Nitin. And the next one. Next one, if you go to, that's our present family, that the son and his wife, and then his daughter, and now there's a new arrival about 2 months ago. And my daughter has also got two children. The elder one is the boy, and the younger one is that girl who is curiously looking. So, in fact, we are that way so far a very healthy and happy family till today. So, so that is that's about the early years. Subsequently, I joined the Calicut Medical College, and then there also and recently for example, our alumni batch, they in fact honored me with one of the distinguished alumni of the batch. I think early education, medical education, I had also had a tremendous impact on why I became a neurologist. In Calicut Medical Colleges was famous at that time. 3 or 4, let's say, unit heads were very deeply committed to neurology because they had all training in Britain, and one or two of them in Queen Square. So in fact, neurology was one of the most well-taught specialty at that time. And in the MBBS final exam, the case I got was long case I got was a Davis torsalis. I think that was the last time I saw. Once you may not even be knowing that what Davis torsalis is, because it has as a neurological condition, it has disappeared. So that is how at that time I decided that I would become a neurologist.
Most of the students don't like to have a neurology case.
Yeah, during those times, but Calicut was different actually. Now it's called Kozhikode. Different because that medical college was famous for this very distinguished 3 or 4 neurology teachers. So some of us really liked neurology being taught, and we were closely attached to neurology patients and the neurology teachings and all those kind of things. Next one, if you go to that will, and then I did my postgraduate training, both my MD medicine as well as DM neurology at the PJ Chandigarh. I consider it as one of the most distinguished academic institutions in the country. I don't know where else in the world you will see 3 CPCs, clinical pathological conferences in a week. Actually, 1 staff CPC and 2 student CPC. Those were the times when MRI and all those things were not available, CT and all. Yes. So whatever diagnosis which we make in those serious patients, this will all, we had a chance to find out whether we were right or wrong when these cases are being presented in the clinical pathological conference. And the Dr. Chutani, he was the director at that time. And he was in fact a perfectionist. He was a bachelor. He was married to PJ, we used to say at that time. And then the one thing which I learned from Dr. Chutani, which most of you had actually a taste of that particular thing, is my obsession with time. You might have seen every meeting should start in time and all those things. Dr. Chutani always used to insist that you start the meeting in time. If there's no one in the hall, you talk to the chairs. That's what he used to say. 8 o'clock means 8 o'clock, and similarly, 9 o'clock it should end. So some of these things which we learned from
you also continued in your practice.
Yeah, that's
so
what.
As a student at Sri Chitra, we
it might have made some of you uncomfortable coming in the early morning and being there in time and all. But I think what he used to tell us is, if you are late, actually you are creating inconvenience for others because their time may be precious.
The most important part was like this starting at 8 o'clock in the morning. I remember you used to take bedside clinics for final year students in neurology residency. You used to start sharply at 8 o'clock.
Yeah.
And not only you start at 8 o'clock, but you finish exactly at 9 o'clock with all your teaching and all references, and how you could manage that time very well.
This is actually Dr. Chutani always says, not only that you start in time, but you should end in time, because the next meeting or your next work should not be postponed. So that's the way the initial teaching, these kind of the mentors, how they influence your, I mean, I'm 74 now, even now I have not forgotten what those people, I mean, told us. The next one, if you take, and because my mentor in neurology is, Professor J.S. Chopra, the late Professor Chopra. I mean, at that time, Dr. Chutani told Dr. Chopra was alone. There was a shortage of people in the Department of Neurology because 2 or 3 of their consultants left the department in a short time and went abroad. So Dr. Chutani told, okay, now you join the Department of Neurology, and then later on, maybe you may have to help Dr. Chopra to bring it up. That's how myself and Dr. Murthy, J.M.K. Murthy, were contemporaries. We were the ones, and Dr. Prabhakar at that time just joined about 6 months ago. So we 3 of us together, along with Dr. Chopra, I mean, brought up the department. That also helped us to learn the department, learn the neurology, not only from the scratch, but also how to bring up an ideal neurology department. This is when I think Dr. Chopra has honored me at that time as an alumni in one of the meetings in PGI. And you can see Dr. Subhash Kaul and Dr. Prabhakar there, and these are all PGI illustrious PGI alumni. And Dr. Chopra, I think the thing which I liked about him is that he always used to tell us, as a teacher, he'll be more satisfied if you become, let us say that if you overtake him, then like you achieve something which he has not achieved. So we used to tell him that's very unlikely to happen. So when I became the director of Sri Chitra, he was the first one to call and congratulate me, say that this is something I could not become the director of the PGI. Now you have become a director of a national institute, and he was very happy about
feeling for him.
Yeah, I think so that I think many of you whom I have taught, I think they have also overtaken me. So that's the kind of satisfaction as a teacher you get when you the people whom you are taught, like Dr. Madhu and all those people, are far better teachers than possibly me. So that is a kind of tremendous satisfaction you get later in the later years as a teacher. And the next one, I think, is
how did you, after completing your neurology residency and their post at PGI Chandigarh, how you your plan to go to Libya? And
yeah, actually, at that time it was after I finished. That was in 1982, 81, 82. Then I joined as a tutor at that time. It is called lecturer at that time. And then I also became an assistant professor within 1 year. Then by the time, actually there were some problems in Punjab and all those things, and we had to, some of us had to leave at that time because of that reason. And Dr. Chopra was, in fact, he was insisting us that you stay back, all of you stay back, and all those kind of things. At that time, the immediate opportunity available at that time was in the Medical University in Benghazi. And initially, when I went there for just 1 year in order to find out a place to go abroad and get further training in either in UK or in the USA before returning back to India. But then there were 2 colleagues who joined at that time, Dr. Ashok, who subsequently got settled in Bombay, and Dr. Sridharan in Chennai. 3 of us together did some tremendous work on neuroepidemiology from there, because at that time the healthcare system there was unique compared to other Arab countries, in the sense that there was a socialistic system. Everything has to go through. There was no practice allowed. Private practice was not allowed. There was these polyclinics where the patients can go initially, and then they come to a university hospital where we work. So by sitting in the hospital, you could get a population-based data, and the population of Libya at that time was something like 5 lakhs. So we could practically, by sitting at the hospital, we could get a population-based data. And why I projected that is, can you imagine something being published in Brain and all from in the journal Brain from Libya, and in Journal of Neurology, Neurosciences, in Journal of Neurological Sciences, and all those kind of things. And you won't believe that it is based on this work that Dr. Kurland from Mayo Clinic, whom we are going to see in the next few slides, invited me to join him. And that also, as you know, the relationship between US and Libya was not very popular at that time in the world. Yeah. But then based on this work, that's what I wanted to project. Based on this work, I got invited.
You have so extensive research in neuroepidemiology, sir. But when you went to Mayo Clinic, how your interest in EEG and epilepsy got filled?
That will come to maybe the next slide. You can see that that's so from Libya. In 1990, I reached the US. Dr. Kurland was instrumental in inviting me. And in fact, he did everything. And he, in fact, even he came to the airport. Can you imagine such a senior person coming to the Rochester, Minnesota airport to receive you and then accommodate you and all those kinds of things? He was something like a fatherly figure to all of us. And then the next slide will show him. If you go to the next slide. And
yes, sir.
That is Dr. Kurland. We used to call him. Previous one you could. Yeah, he wanted everyone to call him Len. And he is known as the father of neuroepidemiology. And because those of us who know about Guamanian disease, the Guam's neurodegenerative disorders, the Parkinsonism, ALS, dementia complex. This was described by Noel Mulder and Dr. Kurland, and they in fact went there. And so, most of us thought that he would win a Nobel Prize for that particular thing. And but then Len was such a kind of passionate about neuroepidemiology. He used to tell that hospital-based statistics, that's not something which you learn. You have to experiment all these things with the population and to prove that regarding how the disease behaves, the natural history of the disease. For example, hospital-based data is usually biased for serious cases until you get it from the population. And he was actually a tremendous researcher and a writer. It is from him that I learned the art of writing. I projected this particular article on cervical radiculopathy. You can see that this has got something like over 1,000 citations by itself. But more than that, what I remember about this article is that he made me to write and rewrite and revise it almost 11 times before we send it to the Brain for publication. So that's a kind of obsession with perfection he had, and the things which you learn from those people, you will carry upon it, and that's what I could pass on to some of you, like Dr. Rathod and all those people who started writing. And that's a kind of obsession from Sri Chitra, and the article which we used to write in a world standard article I'm talking about. Yes. That art I learned from Len. Len is no more. When he expired in 2001, I in fact wrote an obituary in the Neurology India about him. And he's a kind of mentor to, neuroepidemiologists all over the world. And most of them would have, including Bruce Scheinberg and all these people who won the Nobel Prize. All these people have gone through the Bruce, in fact, was in NIH at that time when And so all these people have gone through Dr. Kerlan. I was also fortunate, one of those people who could get mentored in neuroepidemiology by Len, and it's something which you will not forget. Next, when I was working with Len, he told me that you are a tremendous clinician, so you should not stick on to neuroepidemiology. This is something which you should carry on, but you should move over to the clinical side. So this 1 year off, which I took from the clinical side, and it is more than 1.5 years, I worked with Len. That's how I developed my neuroepidemiology and also kind of research instinct and the publication and all these kind of things I learned from him. So that period is, I think most of, I also used to tell everyone that you take a time out for about 1 to 1.5 years from the clinical, then you will know that what you can do as a researcher and a writer. So Len introduced me to, next one please. Len introduced me to two legends in EEG. I can call this living legend, Dr. Donald Klaas and Barbara Westmoreland in Mayo Clinic. That is how I moved to the EEG lab and subsequently to the epilepsy program. And you can see a lot of legends, for example, Greg Casino, Lagerland, and all those people are there from the epilepsy program. And whatever knowledge I have got in EEG and whatever I have passed it on to all the people who have been mentored by me is everything which I learned from these two great people in EEG. They have spent 30-40 years working in the EEG lab alone. So you can imagine that how much amount of depth of knowledge those people have got. If I could gather something like 10 to 20% of what they had, that itself is a remarkable kind of achievement. Okay, the next one, I think there is one more possibly. Then I think in 1993.
Completing fellowship at Mayo Clinic, how you decided to come back to India?
I did 3 fellowships in Mayo. One is with Kerlan, the neuroepidemiology, and then to the EEG, and then the epilepsy. Then this opportunity came from Sri Chitra. There was a phone call, but they wanted somebody to take over the Department of Neurology. The previous head of department has left. So I immediately accepted that. That was a time when Mayo also wanted to offer me a consultant position. So it was really a difficult situation, but my wife helped me as she has done in most of the time when I had a problem with decision. He told that, okay, we are going back to India. And then we returned back with the determination that whatever happens I not return back to US for a kind of long-term settlement for the next 10 to 15 years. That is how I came and joined in Sri Chitra in the end of 2000, end of 1993, or in fact on January 1994. That's how I started in Sri Chitra. And I think as far as
you were away from your family, staying at Libya for so many years, and then at US. So how was it difficult to stay away from family? You had faced any hurdles or difficulties, and how your family supported during that time?
No, in fact, Libya, we were with the family. In fact, my son was actually born in Libya. And in fact, they were with me. And in US also, they were there for some time. But when my daughter was something like she was in the 7th or 8th class, at that time, my wife wanted to bring them back. Otherwise, they'll have a problem with their education. In fact, we were not planning to stay for long term. So they were with me for all of my period in Libya, that 7 or 8 years I was. And in US also, when I was there for 3 years, they were most of the time with me. So I was with the family. Maybe I'm in the last 1 year of my US stay. I was alone there, but at that time I was finishing most of the papers which have to be written and all those kind of things. So I think that I could do it without committed too much for the writing and all those things at that time. And as you know that the rest of the history starts from Sri Chitra as far as the epilepsy program is concerned. The kind of learning I had from Mayo and both in neuroepidemiology as well as in epilepsy, I could utilize it fully during my initially we started that, as you know, the population-based survey in Kerala on epilepsy. That gave us a lot of information regarding not only the magnitude of the problem, but the kind of knowledge, attitude, and practice and all. It is based on that that we, started the Madhav Nair Center for Comprehensive Epilepsy Care, which, as you mentioned, is the first of those comprehensive care facilities, and through which we started the video monitoring and the epilepsy surgery, the revived the epilepsy surgery, and the rest of everything, what happened in India in epilepsy can be traced to the development of the Madhav Nair Center. So that's how that takes. Started from PGI and then went through all these places and reached back India.
We were lucky that you came back to India and started the center.
Next one is, I think that possibly is
regarding sir. Yeah, I have one question for you, sir. Yes, you have strongly influenced and carved career of many neurologists, epileptologists, neurotechnologists, and over so many years when you were head of the department at Sri Chitra. But then we could see another aspect of yours, quality as an administrator when you became director at Sri Chitra. Would you like to share some experience as a director?
I think the what your experience taught me, like especially with Len, is Len used to tell me that don't believe in whatever he says or whatever anyone else says regarding any aspect of it, and you will have to analyze it yourself and then make sure that this is right or wrong. And he, in fact, one of his quotation I might have even told you. You might have heard it being told during the teaching or something in Sri Chitra also. Len used to say that whatever is written in textbooks, 50% of whatever is written in textbooks and the journals are wrong. And your job is to investigate, research, and find out whether the remaining 50% is right or wrong. So that gives you, this I carried upon as an administrator also, because whatever other people have done, your predecessors have done, you will have to see, for example, you cannot, usually you say that you follow the footsteps of somebody. This is something which nobody can do. Because you will have to have something of your own. And for example, during our, let's say, center party at Mayo, as a fellow when you leave, they usually would have a departmental center party. Jasper Dowby, and he's in EMGR, you might have heard about Dowby's is in the neuromuscular, various kind of research which he has done. So he was you can say the chairman of the department. So he asked each one of us, okay, you are from India, somebody is from Turkey, somebody is from Italy, and we used to have fellows from all over the world. He used to ask us that, okay, after returning back to your institution or the country, where you are going to start? Are you going to start from what you left in Mayo, or are you going to start from whatever is existing there in that institution where you join? So most of us gave some told that, okay, they will like to replicate the Mayo Clinic in the institution where they are going. But then what he told was, no, the correct answer is you start from zero. That because you cannot replicate one institution in another institution. That are unique.
You started from zero, sir.
And similarly, you cannot
change the image of.
You cannot follow the footsteps of somebody. You start from zero. You observe and learn what is good there and what is not good there, and then you try to slowly work on it and try to improve. And then each one of whatever others are telling you about, okay, this is the way to go around. You analyze it yourself and make sure that you want to do it, you like it, and then proceed. And that is, so it's something like an evidence-based approach, which you
Yes, sir.
do in research. That evidence-based approach, if you do it in administration also, most of the time you will be doing that, you will not be doing, let's say, wrong things. You at least would be doing something which you wanted to do,
Yes.
something after a thorough discussion with others, so that other people will support you. So that that's I think I think a good academician would also become to some extent a good researcher, because some of things which we do in academics, you can translate it into an administrator in a possibly in a slightly different way. That's a quickest answer I can give to your question.
Yes, sir. Yes, sir. So we were very fortunate to be, we could study at institute like Sri Chitra, and we could get teachers like you. And I've seen you since the day I got admission at Sri Chitra. Yeah, in spite of so much of pressure and workload and all these things, administrative responsibilities, you are always calm and compassionate and you're very cool. And you are very reassuring to your students, not only in academics, but also in their personal life. When I was a student at Sri Chitra, I have personally felt that and experienced that. So what is the secret of that, sir? How you keep yourself so much cool and calm? calm?
Each one of us would have, let us say, anxiety or frustration sometime or other. But I think your capacity is assessed by how much you can control that, and how much you can do whatever you want to do in spite of the adversities. And that's what possibly it decides about it. I think if you ask me that what actually, I mean, what drives me, that it's usually I'm quite bound to time. Okay, I want to do
Yes.
something within a specified time. And then I would have something like an approach also, something like you call a vision and a mission, that you want to achieve this, that's your vision. And then how to do that, that's a kind of mission. And then there will be setbacks, but then setbacks will occur in, I mean, for every one of us. But then ultimately it depends upon how you, let us say, I mean, are you, don't get frustrated by means of that. I think ultimately you just remember that each one of those failures are a stepping stone to success. So once you approach it that way, and then I think you'll have to also get rid of the ego. You might have seen that in spite of, I mean, most of us in Chitra, it was something like a family, isn't it? More than something like a teacher-student relationship. And there were people who were highly knowledgeable, people who were specialists in different fields. But every one of us tried to learn from each other. I mean, for example, try to learn from each other, admire each other. And then we never behaved with you like students, like, for example, Sridhar, as you know that by the time you come there, you already finished your MD and DM. So you're in fact at a consultant level. So we cannot look at you as a kind of student. You're colleagues actually. Some extent par with us. And if you think that way, I think you get rid of a lot of our ego. And that's what Len taught me. Like most of things which we think is correct, they are wrong. So isn't it? So if you think that way, there is something absolute or something dogmatic about it. So your ego will vanish to a great extent by means of that. That's what each one of us, if you do that, and I think there is no scope for a frustration. I think you try to do a thing and you did not achieve it. Okay, that's all right.
It's always been pleasure service with you, and always whenever you speak something, it's always there is something to learn about and something to learn from your talk or your speech and from you. Yeah, yeah, not only academics, neurology, but also non-academics also. Thank you very much, sir. Yeah,
Okay,
other than
welcome.
this,
I'm
this
honored.
yes, sir. So other than neurology and epilepsy, what what else fascinates you about, and what you do in your leisure time?
I think as you know that I write quite a lot. So the scientific article, I read also quite a bit. And in my early days, I used to play cricket and all those kind of things. But subsequently, when you join medical college after the initial years, you left it. Similarly, shuttle also. Then I think we have gone to different places in the world. Most of the countries, except few exceptions, we had been there, and that gives you an opportunity to see the rest of the world. How people live in those areas, and since I am brought up in a kind of village setup. I always like to be away from the cities, and we have a lot to learn from the kind of rural folks and then semi-urban folks. That's what I think. In fact, when we did that epidemiological study from the central part of Kerala, as you know, that which is one of the widely quoted epidemiological studies, I got a tremendous opportunity to interact with the rural people, how they manage epilepsy by themselves, and many a time, and there is a lot to learn from them, how they get adapt to that. Then you will know that these people having those problems are so much living so happily. Then, in spite of everything which you have achieved, why you should be unhappy? So that's a kind of feeling. So there is something to learn from everyone. That's what, either to follow or not to follow. both are learning, and that's where to go about. That's that's a way in which I have moved forward all along.
Yes, sir. So regarding these achievements and awards,
I think the next one, if you ask me to list two achievements, one is, of course, the establishment of the R. Madhavan Nair Center for Comprehensive Epilepsy Care, which tremendously influenced the development of epilepsy care in the country. Not only the epilepsy surgery, but practically in every aspect of the epilepsy care. And then after retirement from Sri Chitra, along with Dr. Murthy and Dr. Rathod, and then we brought up this, what you call the NESSAN, National Epilepsy Surgery Support Activity Network, which has again helped a lot of epilepsy centers to come up. And that work is even being continued. And these are the two, you can say that two kind of organizations through which we could help continuously improve the epilepsy care in the country. If you go to the next one, some of those things are elaborated in the next slide. Next one. And of course, the Sri Chitra and the Madhavan Nair Center where I spent 19 years. That is a remarkable period in my life. The kind of your achievement is, as Dr. Chopra used to tell, they will be decided by your students what you have achieved, and you can see you also, and those people who have completed DM Neurology, and those people who have got trained in the Madhavan Nair Center. Because these pictures only show a small group of people because you can't get everyone in one shot. But then I think this is a reflection of all the people who have got training, and some of them have reached the top, like Dr. Musa is in Cleveland, Dr. Rajesh is in University of Toronto, and Dr. Jairaj has become one of the renowned stroke specialists in the country, and people like you and Dr. Rathod and all those people, and all of you have achieved something which is remarkable in this. And I am sure that by the time you reach my age, and most of you would have achieved much more than what I achieved. So that's a kind of satisfaction you have it. And next one, if you go to, and then perhaps in addition to the human resource development was one of the emphasis of Mayo Clinic, and you can see the number of postdoctoral fellows and then the neurotechnologists. And many observers come from different parts of our country and from the neighboring countries. And each one of them have gone back and started the epilepsy program. And when Dr. Rathod and myself did that survey of the epilepsy centers in the country, out of the 52 centers, near 47 or 48, there were at least one of the fellows or somebody who got training in Sri Chitra or a technologist were working. That's the kind of influence we brought up within the country. And as you know that subspecialty, when I joined in 1994 in Sri Chitra, subspecialty neurology was not there. And in fact, those things like the movement disorder specialty, epilepsy, stroke, and various other kind of things all started in Sri Chitra. And similarly, the fellowship programs also, the fellowship program. I remember out of all the people, Dr. N.H. Wadia, who was the president of the Sri Chitra at that time, when I told him about discussing with him about starting a fellowship program, he thought that, do you think after completing such a long education like DM neurology for 3 years and all, anybody will come for fellowship? And he told, anyway, you go ahead. He was a very kind of positive person. So, but then you can, now you know that there are fellowship programs all over the country. And so we initiated all these kind of things through Sri Chitra and then the Mayo Clinic. That's a kind
culture of development of subspecialties, I think, started at Sri Chitra only.
Yeah, tremendous satisfaction you have. How much you have done for the country through the human resource development. That's a kind of achievement one can enlist. Next one.
Yes.
Through the NESAN, I think after I retired, superannuated in 2013, from 2014 onwards, now we have these kind of monthly meetings in which we discuss the cases and help other epilepsy centers how to select, and then we help them to initiate epilepsy surgery. And this network, and we have got the annual meeting. And perhaps the one to emphasize is when I went to Mayo, what struck me was how poorly EEG is being considered and taught in our country, even from the institutions, like the Institutes of National Importance in PJ and all those places where I had the training. When you sit with Dr. Klaas and Westmoreland, you know how much insufficient we were there at that time. So now through this NESAN EEG course, which runs for something like 3 to 6 months, meticulously taught both through lectures, and then Sunday you have got this the kind of reading sessions, almost close to 1,000 students and neurologists. That's also making significant difference in which, EEG in general in developing countries is very badly done, badly read and reported, and which actually impacts adversely the epilepsy care, because many times you make some wrong diagnosis in the EEG based on which the patient is put on anti-epileptic medication for years together. And they never had epilepsy. At the end of 10 or 15 years, you know that this person was wrongly being treated. So that is slowly changing. And so next one, if you go to and then we have got this EEG workshop where something like the John Dunn, he's also a Mayo alumni, and then from Australia, Perth, Australia, and Dr. Tan also, they also help us in doing this EEG workshop. And then next one, and then we have this the meeting of the epilepsy, in which also some of the fellows take part. And then during this COVID time, we also started this kind of weekly or weekly lectures on different aspects of the epilepsy, which went on for about 3 months, the online, which again is, I think, the advanced epilepsy care and especially epilepsy surgery. This This had a tremendous impact on all those kind of things. Is there one more possibly?
Yes.
And another thing to cite is the EEG book actually, which not only in our country but all over the world. And you can see none other than Dr. Engel. The Pete Engel is actually releasing the book in one of the high-end meeting in NIMHANS. And then that is, in fact, one of the reviews, book reviews, which came in Journal of Clinical, the Journal of Electrophysiology, and that the kind of clinical neurophysiology, and they have highly cited this book, the illustrations and all those kind of things, and that has become something like a benchmark for the kind of EEG book, and that is the other way, the training which I received, and the training and the subsequently after coming back to India, most of my students also taught me, and then all this has been put into with the help of other colleagues in the form of a book, so that the generations from now on will have something like our own kind of book with all the illustrations from our country to read on. So that's again another achievement which I always wish to cite. Is there any? I think that's that possibly finishes the achievements. I think no. I think
yes,
so.
sir. Yes, sir.
Yeah.
This one.
And that's actually the one of the. I mean, I usually don't like to project my own awards or other kind of things. Not that I have won many, but this is one of the Asian Oceanian Outstanding Epilepsy Achievement Award, which in one of the AOAC, Asian Oceanian Epilepsy Congress, was being presented. But more than what I won is one of the patient whom we operated in Sri Chitra. And in fact, without mentioning the name, she also won the kind of outstanding service which she has done. Actually, we are talking about the Yashoda, who is running the Pune, the program. And in fact, she was honored. So I was in fact clapping more for her than rather than.
She's quite active.
Quite active, and so that in fact I will cite that in AOAC. I think her award, I was more happy with that rather than my own.
Yes.
So I think, is there any other? I think that's the.
And the
This
current
is I mean I think otherwise I don't know whether anyone at the age of 72 or 73 would like to initiate a kind of epilepsy program. So after when I left Amrita, then this offer came to, how the offer came is also a kind of the kind of stimulation which you got from your students. Hasib Hassan, who did the epilepsy fellowship. So he called me for a talk in Calcutta. The title of the talk, which is not my title, he wanted me to talk on, can epilepsy surgery be started in one of the semi-urban or rural areas? Should it be confined to cities alone? So I, in fact, told that it need not be, because you can do epilepsy surgery in a semi-urban or even semi-urban setup also. But I think I wanted to prove that. So this particular institution I joined, which gave me an opportunity to start a program in a semi-urban area. And then we have established comprehensive epilepsy program with a monitoring unit. Almost 32 surgeries have been done, and that is after one surgery session. You can see Dr. Girish Menon, and within that group, a previous one, and that photo is after a surgery session for two or three days. He comes and helps helps with the surgery. So this is something now for getting MRI and advanced investigation. I can always call Amrita or Sri Chitra and get it done. And similarly for MEG, I can get it from NIMHANS. And surgery, I can request Dr. Girish Menon and come and do it. So in fact, the world has become very small, isn't it? So if you have got that kind of the enthusiasm to do it, and I think we can do wonders. We may be better than what the Western countries can do at a cost which is fractional, and that's what we should learn. And the next one, please. That's what some of you may be knowing that there was actually based on your publication and the citation and all. No, Stanford University published actually from countries something like the scientists who belong to the top 3% in that country, which is not only the medical scientists but also from IITs, IAC and all. And I was actually listed in one of the 3% of the top scientists from India. So that's again based on, of course, the publications from State Itra is one which actually contributed to this particular thing. So what it tells is that I think there is, if you have got that kind of determination and capacity to do, there's nothing actually which you cannot do, and that is what possibly I wanted to convey to, rather than projecting my own achievement. I think many of you could even achieve better than what I could up till now.
We are coming towards the end of the show, and before concluding, what message would you like to give to young neurologists and students to excel in their life?
As you know me, that the one thing which I usually hesitate to do is to advise somebody to do something like that, because there is usually a saying, there are two types of fools in this world. One type of fools are the one we keep on advising others, but nothing has been asked for. The other kind of fools are who don't listen to the advice. So, so that may be the reason. So I just thought I will just pass on the advice which I received from my mentors to you. This is actually a kind of tribute to Dr. Caroline, who used to tell me that, okay, don't believe in anything what is there in the literature. It's for you to investigate. And can you imagine that something like 2000, BC, Buddha has told the same thing, that don't believe your teacher, don't believe in anything, and you analyze it. So it is nothing new. And similarly, recently, the Orient Devinsky, again, one of the stalwarts in epilepsy, especially the sociological aspects of epilepsy and all, is that in science requires doubt ourselves, doubt our data, our teachers, and other things. So what I mean is that you have to think out of the box. Out of the box, and these days you say not only you think out of the box, preferably get rid of the box, so that you be innovative and you think about new ideas, and then you don't, let's say, extrapolate what others have done, especially from the Western countries, which are not many a time applicable to us. So you will have to work in your setup and then try to develop new ideas and the new kind of protocols and the new data, so that you can feed the world. That's in one of the talks I remember Dr. Engel told that in fact it's not that you learned epilepsy, how to implement epilepsy surgery, cost-effective epilepsy surgery. Yeah. We have learned from you how to make our Western epilepsy more cost-effective, because by doing the investigations which are required, and not to do every investigation in a stepwise way. So that is something which I want to pass on to all the junior colleagues, that you have to do your own kind of ask the questions and try to prove or disprove it. Don't translate it what others have, extrapolate what others have done. Next one, if you put it on there. And the second is that you have to have the belief that you can achieve it. And a quotation from our father of the nation, that if you believe that you can't do it, hardly ever you will be able to do it. But if you think that in spite of the adversaries, like when we came back from the Mayo Clinic. Many initially told me that I think you possibly did the wrong thing. You could have achieved much more by staying in Mayo, because on the other hand, this is a place where you are not sure whether it's going to work or not. But then if you look back, I think I could achieve much more than what if I had stayed back in India. I would be one of the many consultants there. Here, after coming back, you had the unique opportunity to guide the development of the epilepsy surgery program, one among them. So I think you have to have that kind of confidence in your abilities. I mean, your abilities that you can do it means yeah, with that determination, you move forward. That's the second advice, which and third is, of course, remember that none of these things are easy. It's all going to be difficult, and it's never-ending process. For example, a road to success is always under construction. It's never complete. Even after your retirement, it may not be complete. And ultimately, remember that the difficult roads always lead on to beautiful destination. So if you're toiled, ultimately you reach something which you can be satisfied of. The next one, please.
Yeah, I think.
And the last one is, of course, in short, you have to set your dream.
Yes, sir.
A dream big. Big dreams. You should have something with more than what you can achieve. Then only you will reach 50% of what you want to do, and set your goals. Okay, this is what I want to do for the next 2 years or 5 years or 10 years or whatever is, and don't sit idle on it. Take action, and then you'll be able to achieve that. I think hopefully I could convey that the message to my junior colleagues. But always I thought that it's always learning each other. I have learned a lot of things from my students, and hopefully you have learned a few things from me also.
Definitely, sir. Not few things, many things. So whatever we are today, it's because of teachings from you and teachers like you only, sir. And from as a student point of view, I can say that yeah, we have completed MBBS, we have done MD medicine, and then DM neurology at Sri Chitra, and then fellowship. But the academic as well as the homely environment, what we got at Sri Chitra, in spite being from different states, the cultural difficulties, language difficulties, all these things were there when we got admission at Sri Chitra. Initially, we used to little bit scared or skeptical whether we will be able to survive there or not. But the kind of environment we got, the kind of teachers in you, and all the teachers we got, we are very much blessed that we have graduated from institute like you, and as a student, and that is the reason we are here. We stand at present. Thank you very much, sir.
It's a kind of it's not a teaching actually. It's a kind of mentoring. We learn from each other. Because actually, as I mentioned to you, you have all come as something like a semi-consultant, and we have to learn from you, and that you have to learn from us. So it was something like a family. We had that's the way in which I think these are some of the things which you learn from the Western institutions like in the Mayo Clinic. They're actually the students here, at least. We don't call our teachers as by their name, isn't it? You call me sir and all those kind of things. There they will just call you as like Dr. Klaus, and even a person of that. That's the way in which they, at the same time, they learn from each other. So it's actually kind of mentoring means you just guide your students. You don't dictate terms like that. So we know that it's actually learning from each other. That's the way I think each one of us as a teacher-student relationship should be, irrespective of, I mean, whether it is school or college or the MBBS or MD or DM, all it's actually a give and take, give and take kind of approach. That's it.
It was a great pleasure spending quality time with you, sir, and especially knowing about your academic as well as non-academic aspects of your life. and this will definitely inspire not only the consultants, but aspiring doctors, neurologists, and epileptologists all over the world. And I once again thank from my bottom of my heart, Dr. Nirmal Surya sir, for giving me this once in lifetime opportunity. And thank you for his team also. Thank you very much.
Thank you. It was a pleasure, and it's an honor to be here. I mean, they told me legends of neurology. I don't know whether I'm a legend or not. I tremendously enjoyed being with you, and it was wonderful to be interviewed by one of your own students who has achieved equally, especially in the field of stroke and intervention and all those kind of things. So it was a pleasure, actually. I mean, I'm honored.
Thank you very much.
Thank you very much. Good night.